it's CJ. Welcome to week 24 of your pregnancy. Today I want to talk about what's happening with your tiny human, some of the symptoms that you might be having, what's normal and what's not okay. And if you stick around, I will let you know what you can expect if you're scheduled for your 1-hour glucose tolerance test. At 24 weeks, your baby is now about the same length as an ear of corn, measuring about 12.6 inches, that's 32.2 centimeters, from the top of their head to the bottom of their feet. And he or she now weighs somewhere between 1.2 and 1.7 pounds. That's 576 to 765 grams. At 24 weeks, your baby's lungs are starting to mature, preparing for life outside of your uterus. 4 of the 5 senses are continuing to develop, including sight, hearing, touch, and taste. Those kicks are getting a lot stronger, a lot easier for you to recognize. If you're still not feeling fetal movement at this point, it's really important that you let your provider know that. And finally, if your baby were to be born this week and you have access to excellent prenatal care, they actually have about a 50% chance of surviving. Here are some of the more common symptoms that you might be having in the 24th week of your pregnancy. Number 1, your uterus is now about the same size as a soccer ball. Your fundal height, the measurement between the top of your pubic bone and the top of your uterus, is somewhere between 22 and 26 centimeters. If you are carrying more than one baby, they probably won't measure your fundal height anymore. Most likely you will have growth scans to make sure that your babies are growing appropriately. Number 2, mood swings. Because of the hormone changes, stress, and fatigue, it is not uncommon for you to feel really moody these days. If your mood swings are extreme, or if you are feeling depressed for more than 2 weeks, it may be more than just pregnancy related. I would recommend you talk to your provider. Make sure you don't have either depression or anxiety. Number 3, shortness of breath. Again, because of hormone changes, also because your uterus is growing, pushing up on that rib cage. Sometimes it feels like it's hard to get a good breath in. That being said, if you are struggling to breathe, if you have a persistent cough or chest pain, please go to your closest emergency room. Number 4, Braxton Hicks or practice contractions. It can often be caused by a full bladder, dehydration, or if you've recently overdone it. So if you are having Braxton Hicks contractions, I recommend emptying your bladder, drink 32 ounces or a liter of water, and change your activity. If you're up and running around, lay down. If you've been laying down, get up and move around. If those contractions don't go away, or if you are having 5 or more in 1 hour, please contact your OB provider. Number 5, round ligament pain. Those stretching pains whenever you make a sudden movement. You sneeze, you laugh, you cough, you roll over in bed, you get a pulling sensation that can take your breath away. It's perfectly normal. I recommend if you are going to make a sudden movement, try to splint or hold on to your tummy. Make sure you're staying well hydrated throughout the day and try doing yoga or some stretching exercises during the day. And number 6, the occasional spot or two of blood. The cervix has got a lot of blood in it, and if it gets annoyed, like if you've recently had SEX, it's not uncommon to have some spotting afterwards. However, if you are bleeding heavy enough to saturate a pad, please let your OB provider know right away. And finally, let's talk about the glucose tolerance test. That is a test that's typically done between 24 and 28 weeks. The purpose of that test is to make sure that you are not a diabetic that is specific to pregnancy. Early in pregnancy, your placenta was created. One of the many jobs of your placenta is to create insulin. Insulin burns off sugar. Not everybody's placenta makes enough insulin, which can create a life-threatening situation for the baby at birth. So we test almost every woman, every pregnancy. If you are an already known diabetic, you will not need to be tested. If you had an early glucose tolerance test that you passed, you still need to be tested because that was not to test for gestational diabetes. That was to make sure you weren't a pre-existing diabetic. On the morning of your test, some labs will instruct you to come in fasting, some will let you eat. Personally, I tell my patients to eat breakfast, but don't eat any carbohydrates. Bacon, eggs, and lots of water. You're going to come to the lab. They're going to give you a glucola that looks like this, has 50 grams of sugar in it, which is really no different than drinking 16 ounces of Coke or 28 jelly beans. You're going to drink it down over a 5-minute period, and then you have to wait. An hour later, they will draw your blood to see how much sugar you burned off. If you burned off a sufficient amount of sugar, you're not a diabetic. If you didn't burn off enough sugar, it doesn't mean you're a diabetic. It means you need the real test, which is a 3-hour test. Nobody wants to do the 3-hour test, so I recommend you give yourself every opportunity to pass and try not to eat any carbohydrates that morning. I do hope that this information has been helpful, and that if you have any questions regarding the glucose tolerance test, you'll leave those in the comment section below. And while you're in that comment section, I sure would appreciate it if you'd hit the like button, or even feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.